If negligence claim is successful, then the practitioner trust would be deemed to be liable. Liability can be criminal, acts breaching criminal law, like intentional harm. Civil, negligence claims leading to compensation. Product liability, prescribers must ensure patients are informed about drug risks. Vicarious liability, employers may be liable for actions of employees, provided the actions fall within the scope of their role. Prescribers must ensure informed decisions, appropriate documentation, and adherence to regulations. Product liability in prescribing. Prescriber as supplier. A prescriber may be seen as the supplier of a medication, making them potentially liable for harm caused by its use, if they fail to meet required standards. Legal requirements, DOH, 2006. Prescribers must provide patients with complete information about proper use of the medication, potential side effects, safe storage and disposal instructions. This information must also be thoroughly documented. Legislation in practice. Although the legislation around product liability is clear, it is infrequently applied in medicine-related claims. Most cases center on negligence or standard of care issues. This highlights the importance of clear communication and documentation to safeguard both patients and prescribers. Product liability and compensation. Under the Consumer Protection Act 1987, compensation is awarded if it is proven that a defective product caused death or personal injury, loss or damage to property. Responsibility, liability extends to the manufacturer who produced the product, the importer who brought the product into the market, the supplier, including prescribers who may act as suppliers in certain contexts. This legislation ensures accountability across the supply chain and provides protection for individuals harmed by defective products. Responsibilities in product safety. Healthcare providers, manufacturers, and suppliers have key responsibilities to ensure product safety and protect consumers. 1. Warning about risks. Clearly inform consumers of potential dangers associated with the product's use. 2. Providing information. Offer detailed guidance to help consumers understand risks, benefits, and proper usage. 3. Monitoring safety. Continuously evaluate the product's safety during its life cycle. 4. Taking corrective action. Act promptly to address safety issues, such as issuing recalls or updates, if problems are identified. These measures ensure the safe use of products and uphold consumer trust. Accountability in prescribing. Prescribers are fully accountable for their prescribing decisions, including both actions taken and omissions. Key principles include safety and effectiveness. Prescribers must ensure that any medication they prescribe is both safe and effective for the patient and the condition being treated. Informed decision-making. They should only prescribe medicines within their knowledge and competence. Managing pressures. Prescribers must recognize and navigate external pressures, such as influence from the pharmaceutical industry, patient demands, or peer expectations, to avoid inappropriate prescribing. Accountability applies not only to what is prescribed but also to decisions not to prescribe when necessary, reinforcing the importance of professional judgment and ethical practice. Purpose and role of regulatory bodies. Regulatory bodies play a crucial role in maintaining standards of professional practice, ethics, and accountability for healthcare practitioners. 1. Purpose. Standards and guidelines. Bodies like the NMC, Nursing and Midwifery Council, GPHC, General Pharmaceutical Council, and HCPC, Health and Care Professions Council, set clear standards for conduct, ethics, and performance. Patient-centered care. Encourage professionals to involve patients and the public in decision-making to ensure safe, respectful, and ethical care. 2. Prescribing role. Regulatory codes outline expectations for safe and competent prescribing practices, ensuring that practitioners act within their scope and maintain public trust. 3. Professional code. Defines the standards of behavior, accountability, and professionalism expected from practitioners. Regularly reviewed to reflect current best practices and maintain relevance. Key question: are you familiar with the latest updates to your professional code and how it applies to your prescribing responsibilities? This is vital for staying compliant and promoting professionalism. Vicarious liability and job responsibilities. Vicarious liability. Employers can be held legally responsible for the actions of their employees if those actions are carried out as part of their professional role. Clear job descriptions. Both the employer and the employee must ensure that the job description or contractual agreement explicitly includes all responsibilities, including prescribing duties. This clarity safeguards both parties by ensuring that prescribing is recognized as an official part of the employee's role. This principle ensures accountability while providing legal protection for both employers and employees when duties are clearly defined. Accountability spans. Regulatory standards requires knowledge of professional codes and standards for prescribing, like NMC, HCPC. Legal compliance, like prescribing with incompetence. Ethical principles ensuring patient safety and public trust. The following are the list of regulatory bodies. Indemnity insurance is mandatory for all prescribers since 2006. Covers practitioners for legal claims. NHS-employed practitioners are usually covered by their employer, while self-employed practitioners need private coverage. Thanks for watching. Hope you enjoy it. See you on the next video.